Hello out there, welcome to Excel Health Arena. Now we need to talk about diagnosing infertility in men. Diagnosing infertility in men. What are those things that need to be done for us to be able to identify infertility issues in men? First, I'll talk about semen analysis. Semen analysis is a test that checks for low sperm count or poor sperm in terms of mobility or motility of the sperm. So it checks for sperm count, it checks for sperm motility. Some people need a form of biopsy to remove the sperm from their testicles for it to be tested. Some, they will just give them something, they'll give them a container and ask them to go back home. When they are to have sex or sexual intercourse, they can go ahead and collect sample of the semen. The semen is now going to be analyzed to check for motility of the sperm, to check for the sperm count. Then there could be blood tests. In blood tests, the blood sample will be taken to check for hormones, especially organs responsible for production of hormones. They can check for thyroid hormone level. They can check other hormones levels, the levels of the other hormones, the gonadotropic hormones. Okay, genetic blood tests to look for chromosomal abnormalities. These also will be done. They can check genetic blood tests. When they take blood samples, they will check for the chromosomes and identify abnormalities with chromosomes of that particular person. Then there could be scrotal ultrasound. Ultrasound of the scrotum identifies varicoceles, it identifies other testicular problems like that. Then it could also be used to examine the testicles. They check the epididymis, the testicles, they check the other parts of the reproductive tract of the man for any abnormality, any blockage or infections. Then there can be transurethral ultrasound. It will be used to visualize the prostate and identify any abnormality, maybe like enlargement of the prostate, like blockages. Yes, so transurethral ultrasound can be used to do that. There can also be magnetic resonance imaging, usually called MRI. They can do MRI of the pituitary gland and the hypothalamus. This will be able to evaluate the regions of the brain that are responsible for hormone production. Then other investigations could include genetic analysis. Genetic analysis can be able to identify chromosomal or genetic abnormalities, like I said, that can affect sperm production. There could be testicular biopsy, which could be performed in cases where there is sperm production that is very impaired. Okay, when there is impaired sperm production, then they can use testicular biopsy, take sample of the testicle, then they can check the testicular tissue to be able to identify if there's any problem. There can also be sperm DNA assay. That's a sperm DNA analysis. In this situation, they can assess the integrity of the sperm DNA, which is very, very important for fertilization. Then post-ejaculation urine testing. You know, I talked about retrograde ejaculation sometimes. Post-ejaculation urine testing, they want to test if there is semen, if there is sperm in urine. Post-ejaculation urine testing. So they want to identify retrograde ejaculation problem. This is when semen enters into the bladder while it is being ejaculated. Instead of being ejaculated outside, it's ejaculated into the bladder. Then importantly, there is need for medical history. Medical history will require a detailed information about the person, about the man, his lifestyle. It will encompass a lot of things. So many a times when you go to the hospital, doctors or even other people, other healthcare professionals, they want to ask you questions. They are not asking you questions for fun. They are asking you every important question item for them to be able to identify a particular thing. So in this case, a lot of history taking will be necessary because every detail needs to be noted as far as identifying what exactly the problem or the cause of infertility in male is concerned. There would also be need for physical examination. They will examine the man to see those problems that could be identified physically. Maybe in terms of enlargement, in terms of undescended testes, you know, other lifestyle factors that could be, you know, having effect, especially a negative effect on fertility. Then there is a particular specialized sperm function test. They call it hamster egg penetration test. Hamster egg penetration test. Hamster egg penetration test is a test that evaluates the ability of the sperm to penetrate the egg when it is to fertilize the egg. You can see that it is complex. So even when a lot of things have been, you know, examined, and yet they cannot identify what exactly the cause of infertility in the man is, there can be need to do hamster egg penetration test, whereby they evaluate or assess the ability of the sperm to penetrate an egg. It's a very crucial step in fertilization. If the sperm is strong but does not have the ability to penetrate the egg, you cannot fertilize the egg. It's as simple as that. There can also be a chromosome reaction test. A chromosome reaction test checks if the sperm can undergo some necessary changes eventually to fertilize an egg. These are advanced tests. These will require a lot of, you know, financial commitment and all that. So there can be a chromosome reaction test to check if the sperm can undergo some necessary changes for it to be able to fertilize an egg. Then sperm longevity test. Sperm longevity test would assess how long a sperm can survive in the female reproductive tract. It would assess how long a sperm can survive after being ejaculated, how long it can survive in the female reproductive tract. So at least 2 semen samples will be collected and analyzed, preferably about 3 months apart, okay, for it to be able to account for variations in sperm production. So it's not enough to just say, yes, we took 1 sample of sperm and this is what we have been able to identify. About 3 months apart, at least 2. I said at least 2. So that means it can be more than that. That is why sometimes a gynecologist will ask a man to produce sperm samples. You will be wondering, yes, we produce the first sample, we produce the second sample. Yes, you can have cause to produce samples of sperm in repeated cases, okay? It is important that it is spaced. There is enough space between the last sample and the next sample. Then the specific tests and investigations that are needed for a particular, for diagnosing male infertility will depend on the individual circumstances and the suspected causes of infertility.